Thank you, Lesroy. I was asked this question before, and I think I clearly expressed my views on the matter. Now, since that hearing, I've been approached by many persons asking me to shed some light on the views that I expressed. And I anticipated that this question would come up again, and so I have some prepared remarks to address that, which I'll share. One of the qualities we should have as healthcare workers is compassion, which is the ability to identify with the suffering of another or to imagine ourselves in a similar state. And while as healthcare workers on the front line in this pandemic and a part of a group that is making great personal sacrifice in this fight, I cannot turn a blind eye to the suffering of the masses. This pandemic is not only testing the strength and the resilience of the healthcare worker. This pandemic is testing our morality as human beings and the very fiber of our nation, the healthcare system, emergency management, security, the public service, business, attitudes, democracy, and our economy generally. The world is in a crisis, and our country is in the midst of it. Many people globally and here locally are no longer able to provide for their families because of this pandemic. Civil servants in St. Kitts and Nevis are among the fortunate. To date, we are still enjoying a full salary and all the benefits we have become accustomed to. Hotel workers, tour operators, braiders, bus drivers, construction workers, restaurant workers, just to name a few, are less fortunate. These wage workers who depend on the earnings from a hard day's work for survival are most adversely affected. We are asking bus drivers to carry their buses at 60% capacity, which is a 40% pay cut. We are asking others to hold strain until we get through this turbulent path in our nation's history. We expect some to make sacrifices, but truth be told, we all have to make personal sacrifices to get through this pandemic. For some, the sacrifice is giving up some personal freedom and staying at home to prevent the spread of this deadly virus. For others, it's a call to service, bringing us out on the front lines to use our skills, knowledge, and God-given talent to protect the vulnerable and the less fortunate. In this time of crisis, therefore, some of us may be called upon to work beyond the call of duty. The police may have to do more patrolling to enforce the curfews. Teachers may have to learn a new and more challenging way of teaching students in virtual classrooms during the lockdown. Farmers may have to spend longer hours in the hot sun tilling the soil so we can feed ourselves locally. One test of our resilience and commitment to the greater good of our nation is how we behave when our country is in crisis. If at this time we're able to live true to our country's motto, country above self, we would have made a significant stride as a nation. Doctors and nurses across the globe have been working overtime to combat this pandemic. I am grateful to the Almighty God that here locally we have been able to contain the virus thus far below a level which it could overwhelm our health system. We have augmented our staff with help from overseas. We have decreased significantly our elective procedures and have also seen a significant drop in crime and injuries related to crime presenting to the emergency room. During this period, we have had a significant drop in hospital visits and hospital admissions, such that our hospital occupancy has decreased significantly. We have therefore seen an ease on the demand made on the healthcare workers at the institution while we continue to battle in the community to contain COVID-19. We continue to remain vigilant, however, and brace for surging cases while we re-energize ourselves during this brief lull in our workload at the hospital. We have no idea when this virus will leave us or where it will leave us. We may well be in defense and mitigation mode until a vaccine is available. While we are making great strides in the fight here, we are a part of a global economy. We will also be affected by the impact of the pandemic on other countries on which we rely for tourists, students, investment, and trade. This crisis could affect us for decades. There will, we expect, be time for a full and comprehensive review of the impact of the pandemic, of our response to it, and our recovery from it. The middle of the crisis is certainly not the time for such a review. We recognize the value of all our healthcare workers and frontline workers to our country in this war against the deadly virus, and to them we will be eternally grateful. It is, however, very premature and irresponsible to start at this time a discussion on salary increases for the healthcare sector or any other sector within the public service. I can tell you that the view I share on this matter is the view of the majority of doctors and nurses in our federation. It is also the view shared by those in the general public with whom I interact on a daily basis. Last night, while speaking to my grandson, he called me a hero. When I asked him why he chose to call me a hero, his response was, "Because you're fighting the coronavirus on TV every day, Grandpa." It is this show of appreciation for what we do as healthcare workers that gives us the drive to continue this fight and not the promise of money. We understand the importance of what we do, but we do not wish to overstate our importance. We are all in this fight together, and the singular action of each of us will help us get through this pandemic. There will be a lot of time after to discuss salary raises and hazard pay. For now, I beg each and every one of us to get on board with this fight if we are to survive as a nation. That is my answer.